Live event on the go now. Let me take you to Gqeberha, where President Cyril Ramaphosa has arrived for a tour of the Aspen Pharmacare facility there. That's where much of the manufacturing of the Johnson & Johnson COVID-19 vaccine will be taking place, much of it intended for the export market. The president arriving a short while ago. He's being taken through the facility. Let's see if we can listen in and hear what he's being told about it.
We are putting the product into a vial this evening. So the process has already started. This is the disposable single-use technology that we use. It allows us to turn over the line quickly. So once everything has been decanted, we move straight into the filling line. Which is further down. I will show you where we do the filling.
So this is where you get the compound.
This is the compounding. Yes, the vaccine and the buffer come together, and from here then we sterile filter it to prepare for the solution to go through the filling line. So it's
So this is the cook. It's cooking.
Yes, this is the cooking hole.
It's the cooking hole.
Yes.
I prefer to understand it that way. Where's the DP?
Mr. President,
Yeah.
this is the state of...
Yeah.
He's very excited.
Mr. President, this is the filling line. This is where it all happens. From the cooking pot, we go straight into the line.
Okay.
It's a highly automated line. What you see in front of us is called the isolation technology.
Yes.
What it does is that it keeps the environment at the highest level of sterility.
Yes.
To prevent anything going in. The pressure is positive, is pushing everything out.
Mm-hmm.
That's how we ensure that now there's no ingress. Every operation that needs to happen inside there, you have to go through the glove with a sterile glove.
Okay.
So that you don't put your hands in there and compromise the environment and the product that comes out. Mm-hmm. You'll see the floors, the stainless steel is the highest grade 316. Mm-hmm. That is what is required for the operation of this nature. Mm-hmm. From here, the product goes out, and then we will pack it after inspection. Mm-hmm. I will take you through the inspection later. Mm-hmm. So right now, I'm going to take you through to the packaging department.
Okay. So this is where the little vials, the little bottles are filled.
One by one, yes. You saw on the video.
How many per minute?
320 per minute. That's what we set. Every minute 320.
So there's
minimum.
1,600 doses for about 5.
600
600
doses per minute. 1,000. And then is it a sort of 24-hour operation or 16-hour or 8
No,
hours?
we run 24
hours.
24/7.
24/7.
As you see, these guys now, we've just finished a batch early hours of this morning.
Yes.
We turn over the line. The compounding starts. As you see, the next line comes in, so we don't stop. There is no stopping. The only now is we have the line we are setting up for the next batch.
So how many would you produce a day? Nearly a million a day.
Just under a million. Yes,
Just
you're
a
right.
little under a million a
In
day.
one day, but we do the entire batch over 40 hours
Yes.
in total.
Okay.
As we get better and better, and we've seen this,
Yes.
we are now moving below 40-hour mark, which is our cut-off time.
And I think you're being modest. You did so well.
In 30 days. In 30 days.
You know, they're being modest. They did so well that they beat the timelines and the speed's quicker. That's why we produced earlier. I mean, we tested brilliantly, but you can do nearly a million a day.
And this line, did it exist or you built it up or reconfigured it for for the COVID vaccines?
This line was in existence, but it was connected to what you call a stainless steel pathway, meaning the compounding was all stainless steel.
Okay.
But for this vaccine and how Johnson & Johnson runs it, they use disposable technology, which is what you see next door over here.
Okay.
So the line was, when it was built, when it was bought, it was already designed to cater for both single-use technology as well as, so it was thought in advance before we even knew this would come. So when the opportunity came, it was easier to connect and run
That
it.
was something we wanted. That's why you have isolation, which you need with vaccines. It was something that we wanted to gravitate with, so we built it into the footprint.
So how, as they come to audit you, how do they rate you in the global sort of situation? Where are you on the league?
Well, certainly the J&J people, because, we started 5th or 6th and we were one of the first ones out. So we certainly we're top of the thing in J&J. In terms of quality, reliability, you're right at the very top here, because, people like that don't use you unless you don't have to be even equal, you have to be better. And we're right.
So we're world class.
At the highest level.
We compete with Europe and all these other places.
Well, we more than compete with them.
We more than compete.
I don't think we're going to keep use us as a benchmark.
They use us as a benchmark.
They actually are going to be the first, if not amongst the first, to produce for Johnson & Johnson. So they're really very competitive.
Wow.
I'll take it out.
We run a 4-hour shift. Or just on the filling line.
Just 4 hours. 4-hour shift.
We have 4 shifts that run on 12 hours, so we relieve each other every 12 hours.
Okay, yeah.
So others are resting at home, others are here. So
your boots is falling.
So, Mr. President, to answer your
Only a doctor will see it.
that shift, we have 20 people.
Okay.
Come, guys. But that is just one contract. That is for the entire side. It's filling, inspection, and packaging.
All right, at this point I should indicate that the President will be taking the lift up to the packaging floor and the journalists will be required to take the stairs. So there may be a slight break in our transmission of the President's walkabout as we try to get to the floor where the packaging is being done. The President, of course, we will meet him there. So we're going to try and climb the stairs as fast as possible now and make sure we don't miss anything from the President's walkabout. And we should be back within a minute or two to continue with that. Thank you.
Right, as you can see there, that's eNCA's Govan Whittles who's tracking that visit to the Aspen Factory in Gqeberha there by President Cyril Ramaphosa. And as Govan has explained, they are taking the stairs, whereas the President will be entering the lift. And that's why you are seeing those visuals that you are seeing as the team makes its way to the other floor where the packaging takes place. Remember, this is the facility where we are told that that facility will perform what they call formulation. One takes it, that's the mixing, the actual mixing of the various ingredients that are needed to manufacture this vaccine, and then filling into the vials, as well as what they're calling secondary packaging, and that's the part that President Cyril Ramaphosa will see. It is a sterile environment, and therefore that's why you're seeing them clad in those that gear that they are wearing, personal protective equipment, but also to keep everything really sterile at that particular facility. This is a facility where Aspen Pharmacare invested 3 billion rand following its announcement that they will establish this facility in Gqeberha. That announcement coming at the first investment conference that President Cyril Ramaphosa held after his election into office. So therefore, you're seeing that happening. We are told it can manufacture up to 300 million doses of the Johnson & Johnson vaccine per annum. 300 million. In fact, a short while ago, President Ramaphosa asking the pace and the speed per minute and told 320 vials per minute can be produced. Let's see if we can pick up the audio and hear what the President is being told about that facility at this moment.
If we go further down, can we just...
Thank you, Tulasizwe. We're back, and it's a bit of a noisy environment, but we'll see if we can listen in to what the President is being shown.
And fold it.
I can see that.
And fold it. Or pick it up and fold it. And then from here,
It carries how many seats?
it takes one by one, but you have only one
All right, Tulasizwe, it's nearly impossible to hear what's being discussed between the representatives of Johnson & Johnson and the President. I'll just try to explain exactly what you're seeing. So this is the packaging line, and what the President is currently being shown is exactly how the vaccines that were filled in the previous room are being put into boxes and processed in this packaging room. And as far as we understand, this is the last room before it gets put into the boxes and leaves the facility to its destination. Let's try again to listen in to what the President is being told.
So we take 450 cartons per 450 vials per minute are being taken over. We can go to 900.
The representatives telling the President that this machine can pack between 460 and 900 vials per minute.
So it's a 0.5 mil.
Oh, so they take out 3 mil.
Yeah. And then
All right, Tulasizwe, you can see that the President's swamped at the moment. We were pushed away by the security. We'll try to get a better angle and approach it from a different side. But this is a very small room, and at the moment, although we're wearing sterile equipment, there's not a lot of social distancing being practiced here. So we'll try to give you a better view of the President once he makes his way to this facility. For now, I'll try to bring the audio as well.
All right, Govan, we understand the difficulties with the audio. Of course, there's that scrum around the President, everyone trying to get as close as possible. I think I hear, it sounds to me like the audio is improving somewhat. Let's give it a moment. If not, we'll pick it up in just a moment.
Pricing is per what? It's per vial or per dose? Per dose.
Okay. Per person.
$50 for that vial.
Okay. But that's okay.
Yeah, oh, that's correct. Yes. Each one is $10, so it's 10 times 5.
So it's 10 times 5.
$10 times 5.
Each little bottle is
Each little bottle is $50.
It's $50.
Yeah.
I understand that.
And the extra is just in case there's a drop that went off. The drop that goes off, so you don't run short of the vials, of the doses for the last person.
I understand.
Yeah, this money covers it.
So you'll be hearing there, even though you may be straining to hear it, but the president was asking for an explanation of the pricing of the vaccines that are being manufactured there, and he's been told that the pricing is per dose, right? Not per vial, but per dose, and it's at $10 per dose, and the suggestion there being that there are 5 doses that can be extracted from one vial. Well, that's at least what I understand, that it is $10 times 5. So that is the formula there, $10 per dose times 5. That's important information, of course, because much of what Aspen will be manufacturing there will be for the export market. So we have to think about such equations as well.
So is this all the information?
Yes, all the information.
So this is...
No, don't touch the camera, but move back.
Yeah. You no longer write long because no people can, when they read, you get tired. So you scan here and you go straight to what you want and it tells you. That's why there's this code.
Wow.
That's the technology. That's how you do. It's a 2D code. You scan the code and it gives you the information.
Use your phone.
Yes, you can use it. Yes, so that you don't, because if you sit with this thing so thick as it is, you're trying to read it line by line. You can't. Can we move? Come on, guys, move it.
All right, that explanation coming about the labeling of the vaccine boxes, and it seems as if because of the large amount of information that's on the box and on the vial itself, they've developed a barcode that you could just scan, and it tells you exactly what it is, how many doses it needs, and how it should be administered. So that's what they were trying to explain to the president. Looks like we're nearing the end of this conveyor belt. Let's listen in for some of the concluding explanation.
It's coded with a unique number that is recognizable internationally. That's what I want to do. That number will link back to the now, the number is coded on the X. I will show you on the other side. I need to grab one box before it goes in. The box is empty. Yes. As it enters this machine, then it will throw it back. On the other side of the line, the box is filled with seed as a coded batch, all the information. All the information.
All right, at this point, they're explaining how the integrity of each box is maintained and how the codes that are being printed onto the boxes are also being monitored and recorded at another facility. This seems like it's more about the packaging and making sure that each vaccine they're accountable for each vaccine and the packaging, and they're able to explain the process that it went through. This, of course, is very important in meeting the international standards that have been set not only by Johnson & Johnson, but also local standards that have been set by the South African Health Regulatory Products Authority. It looks like we're about to finish up. I think we can hear what the president will be asking now.
And that's the lot number.
We're going to try and go around to try and get a better view of what's going on. It seems as if there's an opportunity to see things from that angle a bit better. This should also give us an opportunity to hear exactly what the president is asking. This representative was explaining the packaging of these Johnson & Johnson vaccines made by Aspen.
The box is glued.
Yes.
Once the box is glued, then we still put on a tamper-proof evidence.
Yes.
So if somebody has tampered with it, you can see. But if it's by accident, the box is already glued.
Yes.
So it means somebody will have to deliberately unglue it, then you know something has gone wrong.
Yeah.
Otherwise, the entire box is a single unit from a security point of view. From here, it's ready for the road. So we are going to take you to the line. We saw on the video these boxes on this side. These boxes, they go in. In a single file, yes.
Yeah, that's right.
So there's the first four.
That's the first.
Yes, and then as soon as the hole is full, it takes about a minute
Yes.
to pack all of those into a single file.
Yeah.
So once that is done, the robot will take it and put it in a box, and then take it out, and then it will scan the box on the outside.
Yes.
That scanning identifies that which carton is in which box.
Yes.
So we should be able to know, we would know that if this box was sent to Australia, which cartons went in there. So that is why that machine and this one, they are linked. If there's the issue with the ink or the issue of the coding, the box gets rejected before it goes into the box. Well, I will take you through so you can see the coding and the box.
To the right of the President, you would see Deputy President David Mabuza, as well as Acting Minister in the Presidency, Mbudza Nchaveni, as well as the Health Minister, as well, Mkhize, and of course the CEO of Aspen here in South Africa, Mr. Stephen Saad. We are expecting some remarks from them a little bit later and an opportunity to ask questions. We've reached the end of the production line. You'd see a number of robots being used here to try and package these vaccines, and this vaccine facility has been described as among the best in the world, competing with the best facilities in Europe. And that was actually one of the questions that was asked by President Ramaphosa. And this vaccine facility is, of course, producing the Johnson & Johnson vaccine at this moment, but there are still a number of other clarity-seeking questions that we need to pose to them regarding how much of these vaccines will be used in South Africa and how much will be for export, and of course some of the more intricate questions around price and when it will be distributed. It does appear as if we're reaching the end of the walkabout, and let's just have a look to see if there are any other comments being made. It seems as if the President is only being shown the robot at this point. I'll try to get you these visuals.
All automated, but you still need the labor to feed the machine, to set up the machine, clean the machine. So although you cannot affect the speed we are running, we need more people. We cannot
Now, what qualification do the people have here?
We have engineers, electrical engineers, we have mechanical engineers, we also have process engineers because we need people who can think along those lines. But over and above, we also have pharmacists and pharmacist assistants supporting.
The people we saw in the port area, in the pitches.
Those ones are pharmacists.
They are pharmacists, you see.
Pharmacists and engineers.
They're the cooking.
We also have unskilled labor. We can't
In front of you now is Deputy President David Mabuza, and it looks like he's also asking a question.
80 vials, times 5 doses per vial.
Wow. Okay. All right. Yeah. Very good.
Just joining us, you're watching live visuals from the Aspen Factory in Gqeberha in the Eastern Cape. President Cyril Ramaphosa visiting that facility right now, looking at the packaging aspects of where they package the Johnson & Johnson vaccines, which are being manufactured at that particular center. Yes, Govan?
Where we cook.
Where you cook. So what did you learn at school?
I did a bachelor's degree in chemical engineering, so I'm a chemical engineer.
You're a mechanical engineer?
Chemical.
Where did you do it?
I did it at the University of Johannesburg, and then I did my postgrad at UNISA.
Okay. So did you have a NSFAS bursary?
Yes, I did.
Say it again.
On my undergraduates, I
Just say,
studied.
I got a NSFAS bursary
I
from
got
the
a
government.
NSFAS bursary. I'm here now.
You're here now. Oh, that's very good. Very good. So then you did you say Johannesburg. And then after that you did
And I'm doing my honors again now.
what you need. Okay. Very good. You still did with the honors?
Yes, I'm studying.
Okay. And so you're happy to be here?
I'm very happy to be here.
You're doing your PhD in what? Pharmaceutics. In pharmaceutics. How much are they paying you?
Salaries are confidential.
Very good. And how many grades actually? She's not telling me how much she's earning.
I'm studying salary.
Not telling me. Wow. No. That's very good. That's fine. What's Cyril would do? Bele Pumala. Sorry. All right, the president just sharing a lighter moment there with one of the staff here at the Aspen facility in Beja. She's saying that she studied using a NSFAS bursary, her undergraduate degree. That obviously very pleasing to the president. And now he's being shown some of the processing of the vials. Let's see if we can listen.
That's why then it has the vial must meet the box.
Yes.
So it moves from this side. So there are multiple, my cameras checking for multiple items.
Okay.
One is checking that the batch number is correct.
Yes.
And the other one checks that the expiry date
Oh,
is
that's
correct.
the camera there.
Yes, the camera checks that the label has got the right information on it. And then the other one checks for the expiry date. The other one checks for the batch number. That is the correct, so that you don't have a batch number on the wrong label or wrong label with a wrong expiry date. So all of this is to ensure that from a quality perspective, you know exactly what is where. You don't miss a tray in between. As you can see, this goes around the corner.
All right, this segment is what we would refer to as quality control, and I think the explanation was given by the representative here. It looks like we're about to get into another tight spot as people try to leave the facility, but hopefully we will be able to have a Q&A session with the president and other members of the delegation in a short while. So how long have you been here?
2.5 years.
2.5 years.
Yes, sir.
You're enjoying it?
Definitely.
You haven't messed up yet.
You have to learn something new every day here.
You must be
That's how you
enjoying this,
do it.
isn't it?
Definitely.
Oh. So what do you do actually? What is your specific task?
I ensure quality
Okay.
is followed throughout the whole process, from compounding, dispensing, labeling and packing. Everything gets overviewed by pharmaceutical team members.
Excellent. Nice to meet you. Thank you. All right, at this point, Tillis, where we'll be staying behind inside the packing facility while the president moves out, and then once they've arranged the space for us to conduct the Q&A, they'll give us a moment to come in and do that. I'm not sure if it'll happen right here or outside, but security does seem to signal us to remain here while the president moves.
All right, Govan, we'll stay with your visuals for the moment until we get clarity on that question of when the president will speak and perhaps address the media. Because as impressive as all of this is, watching all of the technicalities, the big question is, when will South Africa's vaccination campaign ramp up, right? We can look at all the robotics and all the elements of quality quality control and be impressed by the Aspen factory there in Gqeberha. But at the end of the day, at the back of everyone's mind, and I imagine including the President and the Deputy President who heads up the Interministerial Committee on Vaccinations, will be the question of, we see the implementation study that they are doing in collaboration with Johnson & Johnson, but what about actual vaccination campaign that's meant for the broader population? And I do imagine that those questions will be exercising the President's mind and the Deputy President as they tour this particular facility that has been upgraded to the tune of some 3 billion rand by Aspen. And the leadership at Aspen, of course, heavily involved, Govan there. Stavros Nicolaou of Aspen Pharmacare is the lead in as far as the health working group for business for South Africa is concerned. So one imagines, Govan, that we'll get some clarity on questions of whether or not some of those vaccinations will be meant for the South African market.
Yeah, we certainly hope to get that clarity. To confirm, we are being held back now. All the press stuck in this room. The President has left it, and we're hoping to pose a number of questions to them. We came here with the understanding that we would be able to do so, and initially there was a presentation which was given to the President as well as the other members of his delegation, not only by Aspen officials but also a member of Johnson & Johnson, the company, presenting via Brussels on the number of vaccines that they could deliver, saying that in South Africa they're aiming for 30 million doses by the end of 2021. In the African Union in its entirety by the end of 22 they're aiming for 200 million doses, and then they have pledged 500 million doses as Johnson & Johnson to the COVAX facility. So important information that came out of that presentation, and yet we weren't able to access it due to the media kind of being placed in this facility anticipating the walkabout. And so we hope that information that the President was presented with, as well as these other members of delegation, would be shared with us through a question and answer session. It seems at the moment that presence here or our walkabout has stagnated a bit.
Yeah.
We're not sure how far the President is from here, but we are hoping to get into that space in a short while.
And important to highlight as well, once again, that this is the facility where, Aspen announced at the first investment conference to be hosted by President Cyril Ramaphosa that they would be spending 3 billion rand. And this is, we never really tell the story from when the pledge is made to when the facility is now fully functional. And I suppose this is one of those rare instances where we are able to show you and say, actually, they made this pledge, and we are told this is the result that you are seeing to the right of your screen, that facility in Gqeberha. Aspen, of course, is among its leadership is Stavros Nicolaou, who is a known backer of the ANC and also a backer of President Cyril Ramaphosa. You will have seen his name from time to time. He does lead the health working group of business for South Africa, who've been instrumental in basically trying to ensure that enough vaccinations are procured for the country. The reason you are seeing those pictures being shaky, the team moving around at that particular facility to try and give you as much of a picture of it as is humanly possible, while awaiting for President Cyril Ramaphosa to perhaps deliver some kind of remarks at the end of the visit. And Govan, it seems, just for confirmation, if you were able to hear, it seems I heard right, I believe I did, around the costs per dose, that it is $10 per dose, and basically each vial produces some 5 doses. You're talking massive amounts of money here, especially if you're thinking about the export market, right?
Yeah, that's correct. I think I heard the same figures, Tilasizwe. Whether or not that's the amount of money we're paying as South Africa for those doses, I'm not entirely sure. Or actually the clarity that we were seeking there is whether that price that they were referring to was what they were going to sell it after export, and whether South Africa has its own price due to the costs that are being saved through this facility being here. And at this point, we're not sure about that.
Yeah.
We're hoping to get some clarity. But we've just had some information from the president's team indicating that the president has now left the facility. They'll go change again out of the sterile protective equipment, and then the journalists will be expected to do the same. And then once we're back outside where that presentation happened, they'll give some remarks based on what they've seen and hopefully take a few questions. So I think this is where it ends for now for us. So we have to get out of these clothes, and hopefully we'll be able to get in a much calmer setting so we can pose those questions.
Govan, thank you. Navigating quite carefully and expertly, our Govan Whittles, the intricacies of, the technicalities of vaccine manufacturing and pricing and packaging and the robotics involved, while at the same time trying to relate it to where we stand as far as South Africa is concerned and our vaccination campaign that, if we are to be honest with each other, is yet to get underway, right? Let's be honest. Let's call the thing a thing. It's yet to get underway. We have an implementation study with Johnson & Johnson, and that's great. But what about the actual vaccination of the broader population? We take a quick break, and we'll be back with Govan Whittles. As he said, the president will likely make remarks. Look out for that. And Dan Moyane will pick up from Studio 103 here at eNCA. He'll be coming through at the top of 1 o'clock with lunchtime here on eNCA.